everyone. Dan Eisner here from ZLC Employee Benefits Solutions. My passion as an employee benefits advisor is to find better ways for employee benefits, different from those used for the past 20 years. And it's this passion that drove me to develop the Better Benefits podcast series. Along with my passion, I leverage my relatively unique profile, having almost 25 years experience as an employee benefits advisor and being the only chartered professional accountant working in this industry in the local market. We obviously rely on insurance carriers to provide our employees with their benefits programs, but there are fewer carriers in the market now than 20 years ago, and plan sponsors just do not have the competitive leverage they once had. With effectively less competition in the industry, it's as important as ever to assess insurer practices and work to keep them honest. In this episode of the Better Benefits podcast series, I'd like to talk about some areas in the industry where insurers have asked us to just trust them, but where we have had concerns and had to push back. Okay, let's get started. So the Canadian employee benefits marketplace underwent significant consolidation in the early 2000s, with about half of the carriers at that time being bought by other carriers. As such, with the reduced competition, we've since been looking at a true seller's market, with, in particular, three of the largest carriers being Sun Life, Manulife, and Canada Life. They're holding about 2/3 of the national market. And then realistically, we only have about 7 or 8 other carrier options in the market. As well, we do recognize that all of Canada's employee benefits carriers are under ongoing pressure to maintain their profitability and accountability to their shareholders. So, as I said, it's as important as ever to assess how these carriers carry on their business. As employee benefits advisors, we continually review the underwriting methodologies and assumptions used by all of the carriers in Canada. While the fundamentals underlying basic underwriting assumptions haven't changed all that much over the years, the carriers continue to insert new ideas and concepts that we must always assess for reasonability. As well, we need to assess the carriers' philosophies towards new and emerging issues to help ensure the sustainability of our clients' benefits plans. Too often, these carriers simply ask us, just trust us, but we often run into issues that cause us concern. So here's the first example. Okay, we like to call this easy up and sticky down. So carriers are often very quick to assess risks to benefits plans and mitigate those risks relating to underwriting issues that will negatively impact them. Okay, for example, for many years, the trend assumptions used to project insured premium rates have been higher than the actual inflation rates, thereby favoring the carriers. However, they're not as quick to reduce premiums when the reverse is true. One example is around dental trend factors during and now after the COVID-19 pandemic. It is true that dental associations across the country raised their fee guides significantly during that time, and carriers followed suit with their inflation assumptions. Then later in the pandemic, the carriers' inflation assumptions were driven by a disproportionate number of employees returning to their dentists with higher than normal claims. However, here we are now, largely clear of both of these issues, and carriers are still using artificially high trend factors for dental benefits, often in the double digits compared to like 6, 7, or 8% before the pandemic. So here's another example, insured pooling rates. So pooling coverage is essential to protect plans from large claims. However, the rates charged for pooling coverage have more than doubled over the last 10 years without any transparency from the carriers on the underlying costs and drivers. We fully recognize that the costs related to new high-cost drugs pushed pooled claims quite high during that time, but the carriers have yet to disclose the underlying premium versus claims experience of the pooling coverage. Now that the surges in some of the costs related to some of those extremely high cost and high prevalence treatments over that time have largely subsided, so things like hepatitis C were really bad, there should be some relief in pooling claims. Sadly, though, we've seen very little relief in pooling premiums and ironically, still some further increases. Again, without any transparency on the underlying premium versus claims in the pooling coverage. Similarly, we've had issues with self-insured pooling rates. The comments that I've just had are as applicable to both insured and self-insured plans, administrative services only ASO plans. But there are additional risks for self-insured ASO plans. For self-insured plans, the carriers are not provided any reinsurance coverage by way of the National EP3 initiative that you might have heard of. And that's where all of the insured plan risks are shared by all carriers in Canada. So carriers can essentially charge whatever they like for pooling coverage under self-insured plans. What is most worrisome is that, based on our experience, it does not appear that carriers have secured any third-party reinsurance coverage specific to these risks, nor do the carriers proactively disclose their pooling methodologies until after a major claim, which is too late. We understand there have been cases where pooling charges may have actually increased to the point where they actually exceed the extended health claims after a major pooled claim. And unfortunately, after that kind of a major claim, no other carrier is going to touch you. They're not interested in providing quotes in a marketing given the poor claims experience. Okay. We also need to be cautious about new underwriting concepts. Because another way to overstate insurance premiums and make them more advantageous to the carriers is to introduce new underwriting concepts, which may be difficult for plan sponsors to assess without having any real experience in underwriting. For example, a couple of years ago, one carrier introduced inflation trend factors for long-term disability premiums, and they were citing that there would be increased utilization of these plans during difficult economic times. But in turn, they refused to apply an offsetting negative trend when we would run into positive economic times where we might see a reversal. In another case, some carriers introduced fluctuation margins into fully insured experience-rated health and dental plans. Okay, they're already using high trend factors, and they're already being paid profit and risk charges for carrying the insurance risk. That's what insurers do. And lastly, there used to be a time when we had one or two carriers who were bold enough to use inflation trend assumptions that are actually below the rest of the industry. But sadly now, all the carriers basically use similar or close to identical trend factors. Unfortunately, that's kind of what you would expect to see under a true oligopoly, not a competitive market. We rely on carriers in Canada to provide us with employee benefits plans that our employees value and rely on them to help ensure sustainability of those plans. However, we're repeatedly asked by those carriers to simply trust them. But as we've seen, we find some of their methodologies hard to accept. It's not surprising that one can become skeptical about whether concepts like these are really about plan sustainability that would benefit both the plan sponsor and the carrier, or whether this is simply about plan profitability to benefit the carrier and their shareholders. Without greater transparency from the carriers and the industry more broadly, we as employee benefits advisors must continue to be skeptical and do our due diligence to protect the interests of our clients. Now more than ever, it's important to work with an advisor that has the necessary skills, experience, and market leverage. You need to work with an advisor that can help plan sponsors better understand the true risks facing benefit plans and to assess the validity of the underwriting assumptions and methodologies used by Canadian carriers. Okay, you've heard my thoughts and opinions, so please let me know what you think. How does this compare to what you might be hearing from your current advisor or other advisors in the market? As well, I'm always interested to know if there are other current topics that you'd like to see me cover in a next podcast. Let me know what's bothering you or keeping you awake at night with respect to your employee benefits plan. Thanks for joining me today. Be sure to follow me on my LinkedIn business page. That's Dan Eisner, Employee Benefits Advisor, and you get a notification on the next Better Benefits podcast. And all that information will come up on the screen in a second. Thanks so much.